The World Health Organization has declared the spread of monkeypox to be a public health emergency of international concern. They currently use that designation to describe only two other diseases, COVID-19 and polio. Since early May, more than 16,000 cases of monkeypox have been identified across more than 60 countries. Right now, there are about 2,900 cases in the U.S., including 2 children. But the head of the CDC says that's likely an undercount, and it has not been declared a public health emergency in the U.S. Joining us now to break down what this means and what you need to know about its spread, Dr. Ann Palmer, an infectious disease specialist with Hartford Healthcare. Dr. Palmer, thank you so much for being with us.
Thank you for having me.
So some of this recent news is obviously very concerning. What do we need to know about monkeypox and just how contagious it is?
Okay, so I'm first of all not to panic. All right, usually is a very self-limiting disease. It's a virus, part of the orthopox virus family, very similar to smallpox, which was a big issue many years ago, especially in the 80s. It's usually transmitted through respiratory secretions, very close contact with people who are infected, or contact with the lesions, with the rash. Also with things that have been in contact with the rash, like clothing, like linens, bed linens. So it has to be close contact, also sexual contact, so kissing, cuddling, things like that. It's the mode of transmission that we know as of now.
The CDC is saying that there are some concerns about people not reporting cases, that the actual numbers may be far greater here in the U.S. Why do you think there is such a disparity between the two numbers?
I think there is potentially stigma. So, being stigmatized with the disease, and especially with the mode of transmission that we're seeing right now, which is more than basically sexually, like we have what we discussed previously. So I think the stigma is a big part of it. Probably that's why it's underreported. People don't want to be recognized as carriers of the disease, or don't want to go to the hospitals or urgent cares and just be pointed out as a cluster of disease.
And what can we do, doctor? Are there vaccines available? Are there any precautions that we can take?
Yes, absolutely. So first of all, it will be being cognizant of how the disease is transmitted, right? I think that is extremely important. There are vaccines. We're reserving them for people who have deemed to be an intermediate to a high risk of exposure, for a patient that has known monkeypox or suspected monkeypox. In most cases, like I said before, is a self-limiting disease. Also patients with immunocompromising conditions that can certainly have a more severe disease course if they were to become infected or exposed to somebody with monkeypox. But if you have, especially the population, if they know that they have had contact with somebody who has monkeypox, self-isolating, monitoring themselves for symptoms, notifying authorities when appropriate. And certainly if you know that you have monkeypox or suspect that you have monkeypox, seeking medical help, and of course self-isolating it as well to protect the public.
All right, a lot of good information there. Dr. Ann Palmer, an infectious disease specialist with Hartford Healthcare, thank you so much for being with us.
Yeah, thank you for having me.